that you know about payments.
It's the child in class. It's the child on the basketball court. It's 18,000 undocumented children across the state. Oregon Action's regional director, Michelle Glass, says none of them have access to health care.
And these are some of our most vulnerable populations. They're usually low income and don't have any other means of accessing health care.
Glass says state law is to blame. The state legislature failed to pass the Health Care for All Kids bill this summer.
So we did try to remove the language under Oregon law that prevents the Oregon Health Authority from providing assistance to these children.
Oregon Action wasn't able to get there this past session. Glass says this is another year these children suffer the consequences of legislative inaction.
If children aren't getting critical health needs addressed in that birth to 5-year period, it's going to affect them throughout their life.
The backup plan for undocumented families, the emergency room. Glass says many parents don't want to put their children at risk of an injury, so many don't let them play sports. Kids Unlimited Executive Director Tom Cole says undocumented status doesn't necessarily keep parents from letting their children play sports. He says there's a bigger picture.
Is it transportation to practices? Is it fees? Is it equipment necessary to play those sports? And so I think it's looking at it through a much larger lens.
Cole says about 740 kids enrolled in the nonprofit's free or low-cost sports programs last year. 50% of those children come from Latino families. The organization doesn't track its students' immigration status, but Cole suspects some are undocumented.
Our organization has taken a lot of steps to ensure that more kids are playing, and what we've seen is those numbers continue to increase.
Including all children, something Glass says Oregon Action continues to fight for.